Every patient has a story. In this room today, there are patients, next door patients, and all over Stanford Medicine X, there are amazing patients giving amazing stories. And I'm just another one of those guys. And for the next few minutes, I'm going to talk to you not so much about my health story, but about my journey as a patient through to someone that's developed sensor technology that is now being piloted and used in hospitals. Just to give you a bit of context, the sensor device for me started at a really clear moment, and it was my oh shit moment. And I'll go on to explain why it was that moment in a second. But just to give you a little bit of context on my health journey for 2 minutes as to how I got to that moment. So I was diagnosed age 12 with the incurable bowel condition Crohn's disease, which many of you are probably familiar with. Wind the clock forward a number of years, 25 surgeries, and I find myself with intestinal failure and basically kept alive through intravenous feeding for 2 years at a major London teaching hospital. They tell me transplant is the only solution for me, but don't have it in the UK because there's only been 10 before you and 5 of those sadly didn't make it. So a brief stop to Mount Sinai Hospital in New York, and I did end up back in the UK, and I ended up back at a wonderful place in Oxford, Churchill Hospital, where on the 8th of October 2011, at exactly 6:01, I kissed goodbye to my loved ones and didn't know if I'd ever see them again. 15 hours or so later, I was wheeled into ICU, having become a successful bowel transplant patient. Now, that journey to recovery was basically 7 months in hospital. During one of my earliest memories of being in hospital was very simply tapping my stomach after surgery, because I knew that as part of transplant, I was going to be given something called an ostomy. For those of you who don't know what an ostomy or a stoma is, it's where part of your bowel is brought to the outside of your stomach and your bodily waste is collected in a bag. Much like this, that everybody tells you is flesh-coloured, but it wasn't, so I printed on it, and that became my bag. Anyway, you suddenly are faced lying there with a situation that you have no control over how many times you go to the toilet and when it's going to go. And not only that, you then work out very quickly that they want to know, they being the doctors, what the hell is coming out, and when's it coming out, and what's the volume. And the one thing about stoma care is it's quite an old style situation. So how do you measure output? You empty that bag into a jug. And if it hits the jug, you're lucky. And then you manually enter it onto an input and output chart. And you lie there in hospital and wait for that output to happen. And that was really my oh shit moment, because I'm lying in the bed at night and I hear this great big gurgle, and then it's, oh shit, that bag is full. And then it was, oh shit, it's leaked. And at that point, it was really, I now need to take control over what's going on. This is ridiculous. And as we heard earlier this morning, all of us, I left it over there, including me, spend my life on my mobile phone. So I just assumed I'd go on my mobile and I'd do what every single patient does, Google for a solution. Because let's face it, I'd find something in the US, because come on, you come up with everything, you're bound to come up with something that would help me. But you failed me, and you didn't come up with anything. In fact, there wasn't anything, and I was like, this is ridiculous. I got 7 months, how much daytime telly am I going to do? So I started to look at what was happening as the output was developing in this bag. And basically, what was happening is, as my Union Jack was filling, so the bag was changing shape. So it was expanding. And I wasn't going to put anything in the hole that touched this bowel, because it took me 3 weeks to even look at it. I wasn't going to touch it. But the bag changed shape every time it filled. And I was like, okay, there must be a way of working out how that can tell me what to do. So I bought a few bits on eBay and played around with it. And this is what I made in the hospital bed. This bizarre thing, this strip, this flex strip, actually came out of a Nintendo Wii glove. And the reason it came out of a Nintendo Wii glove is because I worked out that when you put your hand in the glove and you did that, it lit up, or it made a noise. And I'm like, okay, well, if that went on the outside of a bag and the bag bent, I could make it light up, and that would be cool. I'd have a Christmas tree for a bag. The only problem is I didn't want the bag to light up. I wanted, which is what we all do, to spend my life using my mobile phone. So the deal was I had to get this to send a signal to my mobile phone. Now, I've got no electronics background. To get to this took hours of buying parts on eBay and loads of YouTube videos because I really did not have a clue what to do. But from this, I was able to go and start to talk to clinicians and go, look, if we strap this on the outside and we set the alarm, it buzzes. It's going to be able to help me, tell me what's going on filling the bag. And I went out back to Google and I'd become very involved on social media and all the online platforms and started talking to patients and doing effectively what in the corporate world you probably call focus groups. But for me, it was just talking to other patients. And very quickly, I found I talked to about 20,000 stoma patients from around the world, all of whom would say, yeah, it always leaks. And yeah, we pretend we know what that output is. And when they phone, we just tell them it's full 8 times a day, or this time it was 4 times. We don't really know, but that's just life, isn't it? And every so often we'll change our bag. And so I started posing questions, but what if you could find out what that volume output was? And more importantly, what if you had some way of letting you know if that bag was filling? And the feedback was great. Yeah, I'd like this, I'd like this. And then I could be able to sort of be really cheeky and go, would you pay for it? And how much would you pay for it? And what would you do? And build up a business case and a picture for that. And this was really good because they thought I was probably some odd bloke. Actually, I was just a bloke sitting in a hospital bed with nothing better to do than ask these strange questions. So 7 months later, I get out of hospital for 12 hours. I then have acute rejection. I come back in for another 2 months, which was actually quite good because I could do some more user testing on other patients, so it was fine. It was quite an important thing to do. So I'm quite glad the valve failed for a period of time. But during that time in hospital, I then started to work out that whilst this was a solution that ultimately was about me, being honest, very selfishly, it was about how could I improve the quality of my life, I then realized it could improve the quality of other patients' lives. And in order to do that, it had to become a business. And hey, my background was not really business. It was consumer product marketing and licensing and that side of things. So I then had to start to understand what it meant to interact with the healthcare system as a business, what regulatory things meant. God, FDA, I had no idea what that was, let alone CE markings and things like that. But it's amazing what you can get away with when you're a patient. It's amazing the questions that you can ask that probably to everybody else seem really stupid. But if you don't know, you just ask them. So I did. I picked up the phone to the FDA, and I got through to the gastrointestinal department, and I said, I want to get approval for my device to sell it into America. And then he said, yeah, no problems. Get your lawyers to talk to me, and we'll go through the process. I said, you don't understand. I don't know how this works, and I've just come up with a device that I really think can work for other patients. How do I do it? And he was like, yeah, great, we'll chat it through. And I could ask really stupid questions. And then I could go back to the NHS and ask the same questions, except the only problem with England is it took them 4.5 months to answer a question. And it still does. So coming out of hospital, it was very much, okay, I'd spent 9 months or so on transplant and 2 years before that in London, so I didn't have a lot of money and was off benefits, and I needed to convince someone to put some money in to make this work. And then you come through to this wonderful world of investment, which is like, what the hell is that? Can't I put it on my credit card? But you realize very quickly that as a patient, you have one thing that perhaps others don't always have. You have a real understanding of the problem you're solving because you live it and you breathe it every day. And if you can demonstrate that there is a need and you can demonstrate that you have a passion to try and solve that need, you can convince somebody to be stupid enough to give you a bit of money to develop a device. And I think you've got a program here called, is it Shark Tank or whatever it is, and we call it Dragon's Den, you know, where you go and you pitch your ideas and somebody eventually gives you some money. And I did the rounds. 2 or 3 people were very simple. They were like, why am I going to give you money? It's a 50% survival rate. You might be dead before you get the money. And I was like, okay, I get that. That makes sense. And eventually I got a really nice guy who put in some money. And we were able to go and develop the device. And excuse me. the device has ended up today like this, still with the original Nintendo Wii flex strip. Still with a flexible clip that allows it to go onto the outside of any bag, and with a Bluetooth sensor module, a Bluetooth low energy sensor module that means when it clips on the outside of a bag, it sweeps constantly for a change in that bag and sends a signal to your mobile phone. You download a free app as a patient, you set your alarm, and it alerts you as your bag is filling. No more accidents, no more spills. But then my surgeon was like, that's great for you, but it doesn't help me. I want to know what that data is. I want to know what that output is, because if I know what that output is, I can start to predict what's going to happen to your bowel. So, okay, so we create an algorithm that matches the expansion of the bag with the volume, and it captures that data and then just sends it to the cloud or sends it to him on email, and they start to remote monitor what's going on. So very simply as a patient, I'm told 1.5 litres of output is what you should have as a stoma patient. If it goes up to 2 litres, you're knackered, and if it goes down to 1 litre, you're really knackered because your bowel's not working properly. And they could remote monitor it, so I didn't have to come back to the ER for dehydration or electrolyte loss or this or that. So we started to develop a device that worked, and then the wonderful FDA man then started saying, now you have to fill in these forms. And it was like, oh my God. And then you need to patent protect it, and then you need to do all the things to make it become a business. But again, just going back to that word of being a patient, you get a chance to ask the questions that perhaps are so obvious to a lot of you, but not to me. What is a biocompatibility test? What do you mean this plastic is going to brush the skin and therefore it has to be medical grade? I didn't know what that meant, but you learn. You learn, you understand, and 9 months later I was able to get regulatory approval. And now, 510K approval here. In the UK, they're still looking at my project. You have to realize 6 months has gone on, and I'm still about 35th in the queue, but we will get there. But I think one of the interesting things, and I'm conscious of my time, so you're giving me the nod to move, is there's a psychological thing that when you go as a patient and you develop a product, and then you have to go into the business world, because the business world talks about the cost savings and talks about actually what is this going to save me. And as a patient, I'm really interested in how's this going to improve my life, and how's this going to improve the quality of life, how's this going to make me go out and do all the things that I want to do in life. And you have to learn to manage all that. And there's no real lesson in doing it, except for asking and asking and asking, and no question is too dumb. And you asked, and we were able to build a cost savings model. And yesterday, thanks to Stanford Medicine X, I was able to go and meet the surgeons at Stanford, and they're going to do a trial, a pilot of the device on the wards. So I just want to end with this. A year or two ago, the guy who's now become the managing director of the National Health Service said at a conference, he said, the greatest underutilized resource in healthcare are patients. He then got off the stage, and I was like, that's fantastic, Tim. And then he goes, yeah, Michael, I haven't got a bloody clue how to use you. Patients can make a difference. They really can. We've heard so many different things today, and not just in how we manage our condition, which is obviously what we're being told an awful lot to do, to take care, to take extra responsibility for ourselves, and I absolutely buy into that fact. But you know what? We can come up with solutions that work too. So thank you very much for giving me a few minutes to talk to you today and sharing my experiences.